So it's me again, Passent, and I am raising awareness about cutaneous T cell lymphoma. I know it has been a while since I posted the video, but I wanted to make sure that when I post something that is something of a value to the people who are suffering from this disease, or for the caregivers, and for the people who want to know more about it. So since that is now, I can see that more patients are offered the stem cell transplantation procedure. I would like to give you some information and insights about my own journey, as I did the stem cell transplantation 1 year now, and it was a tough recovery, of course, but more or less I am settled down at a good point. So this video there will be no translation on the video, because the Arabic speakers requested that I do more of an Arabic speaking video precisely for them, and I will do that. So I will post an English version of the video and also an Arabic version. It will not be a word-by-word interpretation, but I will follow covering certain points in both videos so that you have the same information. Okay, now you know what I'm gonna speak about. I would like to start clarifying what is the difference between stem cell transplantation and bone marrow transplantation. Because usually people are confused. The main difference here is that the donor in the bone marrow transplantation, they need to hunt the cells through an operation, and usually they get the cells from the hip. While in the stem cell transplantation, the donor can give the cell through like a dialysis-like machine. So there is connection from the machine from the right arm to the left arm, or vice versa, I don't remember. They collect the blood inside this machine, and the blood passes through the machine. The machine selects the stem cell that is needed, and usually this process takes around 6 hours. If everything went well, then you need to do this as a donor for 1 day or a couple of days. Other than this, that's all for the donors. They, of course, before that, they take some medications that increases the stem cells in their blood so that there is enough to be hunted. In my case, it was my daughter, and she was the donor. It's a long story to be said, but maybe she would love to share with you her version later on. I'm not sure of that, but usually it is not a painful procedure when it comes to stem cell transplantation to the donor. The first stage is, I will use this paper because, as I said, it will be a reference for me when I do the Arabic video. So the first stage is that when you are offered this procedure and why you are offered it. As I mentioned before, that the cutaneous T cell lymphoma is a disease that you can live with, but not to die with, or because, so it will not cause your death usually, but there is this 20% of the patients generally who are diagnosed with cutaneous T cell lymphoma will need this severe procedure, which is the stem cell transplantation. And I was one of these people who had a variant of cutaneous T cell lymphoma that needed this procedure. So if you are diagnosed already with any of the cutaneous T cell lymphoma subtypes, like mycosis fungoides maybe, or even Sézary syndrome, You might and you might not offer the stem cell transplantation. It depends a lot on, of course, your team and what they think is the best for you. But also you need to educate yourself enough so that when it comes to the right decision to be taken, you need to take it on time and not to be late. Because I was offered the stem cell transplantation a couple of times and I was, no, I don't want to go through this. And I felt the risk is really high for me. But then thanks, of course, to the team who convinced me at the end that this is the best way out of, and the only way to relieve for my pain. So returning back to the stages. So now if your team did all the blood tests that needs to be done so that they took with you the right decision that you need the stem cell transplantation. What's next? Okay, now the team will be challenged to put you into remission, and this will be a temporary remission so that they can do the stem cell transplantation. It's a big thing because putting a person with cutaneous T cell lymphoma into remission is not an easy job. It's a rare disease. There is not too many options, so they need to maybe choose from different chemotherapies. There is no protocol for it. As it is rare, so each one is different. It's like a fingerprint. Each one of us as a patient is different, and the references and statistics are really limited, and the research field is really huge and opened in this area. So it's not easy for the team to find the right chemotherapy or the right combo for you that will put you into a temporary remission so that they can go for the stem cell transplantation. So the first challenge is to find the right combo, which is usually a chemotherapy and radiation. Sometimes they choose only one, but in many cases it's both. So in my case, it was both. What should you expect during this period? There is a trial and error also even in this stage. So whenever you are getting prepared to take a new chemotherapy, please follow the following. Try to meditate the night before, and this meditation will help you so that you can regulate your blood pressure. When we meditate, whether it's through yoga, through prayers, or maybe listening to some meditation videos that is in the internet right now on the YouTube, you need to try to feel each and every word you are hearing, whether it's a meditation session or your prayers, and believe in what you are saying, because this will play an important role in the whole process. It will keep your blood pressure in a normal, like in a normal phase, and also it will make you more of a calm. And I am saying that because although I was meditating, but I think I was really afraid, and it's normal to be afraid, of course. And there was friends of mine were with me on WhatsApp when I was into these sessions of chemotherapy, and I think once I was really devastated by it, and I was really afraid that I couldn't complete the chemotherapy session one time, and the nurses were really nice, and they gave me a bit of time to relax and to contact whoever I would like to speak to over the phone, so that I get more of relax and relief. So my friend was like meditating with me on the WhatsApp, and she called, um, and it went. I returned back to the room and I completed my chemotherapy session. It's not easy, I know, but it is done if I did it. And I'm a normal person who gets sometimes afraid, and I feel sometimes down. Then you can do it. So this is the first thing. The second thing is that if you are taking the chemotherapy sessions to put you into remission, as there is different option, if you feel anything that is abnormal during the chemotherapy that you are taking, please tell the team around you. So if you felt like an unusual rash, if you felt like pain, back pain, especially lower back pain, please tell or difficulty in breathing, or fast heartbeats. All this will be indications for the team around you to know if the chemotherapy needs to be changed, or maybe you need to have antihistamines or cortisones, maybe to help you relieve a little bit some of the symptoms of the chemotherapy you are taking. So this is regarding the chemotherapy. The other thing is that there will be a radiotherapy sessions. The radiotherapy sessions for me was around 4 weeks. And it was quite an experience. It was a new radiotherapy method that they used with me, because I've expired all my the normal radiotherapy that any other patient can take, so they used a different technique with me. The thing that I would like to advise you when you do the radiotherapy is, again, of course, tell your doctors if you feel anything abnormal. If you feel really stressed about it, they can give you something that make you a medication, of course, that can calm you down. Please don't resist this kind of help, because I was a tough patient and I resisted to take any medication that would help me to be calm. And this is because in my back mind, I was like, oh, maybe I will be dependent on this kind of medications. But this is not true, because we need it when we are sick or when we go through what I've been through. It is needed, and you shouldn't be resistant to this kind of medical help. I was really tough in this. And I still remember that during the stem cell transplantation, I was, of course, in pain. And then the doctors came to me in the morning and they said, the nurses said that you are in pain and we would like to offer you some medication, strong ones, so that you don't feel the pain. And I was like, no, maybe I will be dependent on it. And the doctors were like, are you serious? You are doing a stem cell transplantation and you are afraid to take something to relieve your pain in order not to be dependent on. So it was like a joke. But of course, at the end of the day, I said that I need a pain relief. So take something to calm you down if you feel stressed due to the radiotherapy sessions, or even the chemotherapy sessions. When you finish the radiotherapy sessions, usually the chemotherapy and the radiotherapy, the whole combination, maybe it will take them around 6 months to get you ready and to put you into temporary remission, so that there is no malignant cells inside your body or on your skin, so that they can go for the stem cell transplantation. Once your team the oncologists say that you are now free, they can't see any cells on your skin or in your blood that are malignant, then you are ready and you will be in the hands of the stem cell transplantation team. And then the excitement happens. It's tough. It's tough and challenging. And I want to tell you that usually they will meet you before you go, of course, for the stem cell transplantation. So the team of the stem cell transplantation will meet you before that. And they will tell you that when you will start with them, the side effects will be that you will lose your hair, and there will be some usually internal, of course, reactions to the chemotherapies that they will give you. But I want to tell you that when you will start the chemotherapies with your team to put you in remission, usually, and when you take the radiotherapy, usually these side effects already take place. So when I went to the stem cell team after I finished the chemotherapy and the radiotherapy, I was already like done. The hair, I lost, of course, my hair, and my white blood cells were already down. I needed blood transfusion a couple of times. So when you are there, you will be already in a status that is your functions are a little bit down because of the preparation. Once you are with the stem cell ward, they will count with you like 10 days. So you start 10, 9, 8, and on the day 0, you will receive your stem cells. Why are these 10 days? The 10 days are, I think it's a set protocol, and it's not only here in Sweden where I did my stem cell transplantation. When I like communicated with other patients from different parts of the world, they do the same. These 10 days are the real preparation for the stem cell transplantation. What they are giving you is the chemotherapies to put off your bone marrow completely. It's a big thing to put off your bone marrow completely. So no white blood cells, no red blood cells will be out from your bone marrow. And this will happen for a few days. And then on day 0, your bone marrow should be totally stopped and the transplantation takes place. So when this happens and the transplantation starts as a procedure, usually you have everyone who does like extensive chemotherapy, they don't use cannulas, of course. They use a port that is implanted inside the chest, and it opens a vein in the neck so that it's easy for them to put the chemotherapies directly in a thick vein, and doesn't need to poke you like every single day, twice, like for a cannula. And of course, like the veins in the arms will be very thin to tolerate the chemotherapy. So usually the stem cell transplantation happens through this port, and voila, you are ready now, receiving the stem cells. It's a huge moment, and I remember it, of course, the people around me, my daughter who was donating, my other daughters who were at home. It was a big day for everyone. My friends who came from Qatar to be with me, my cousins who came from Egypt to be with me, it was actually a big day for everyone, for my mom, for my husband, and it will be also for your family. The good thing that happened here is that the people who were around us distracted us during this moment, and they tried to ease it as much as possible, and it made so much difference. So if you know somebody who will be going through the same, please distract them as much as you can. And usually the transplantation of the stem cells takes around 2 hours, I think. So the stem cells runs into your body, the new ones. It's of course a different feeling when you feel that you are receiving new stem cells that will make your bone marrow retrieved with a new DNA and maybe a new blood group also, because then in the best scenario you will be 100% matching to your donor, and the donor doesn't need to be the same blood group. So it's a moment. It's a moment definitely that will make a difference in your life. After you finish the stem cell transplantation, usually it takes 2 hours, as I said, and in my case it took us 2 days to get the number of stem cells that the doctors needed for me. So my daughter donated on 2 days consequently, every day 6 hours on this machine that I described. And after each day they take after she finishes, they take her stem cell, the precious ones, and they put it inside in the lab where they work with it in order to take out some cells that my body might react to it, because we were 50% match only. So this was the main thing also, like that it happened that there wasn't no donor 100% matching to me. My brother of course offered to donate, and usually 35% of siblings are 100% matching. But what happened was that my brother also was 50% match, so the doctors preferred my daughter. As they said, the reaction might be a little bit milder from your body, as we are the same, like gender, and also that she was already inside my body one day. So it was a little bit complicated for me, and but again, if I, with all these challenges, I really challenged the team, because it was not only a rare disease, but there was no donor. They couldn't find the donor, and it was only 50%. My daughter was very young to be a donor also. When we were discussing this procedure, she was 17, and I didn't want her, of course, to be my donor, because the usual thing is that we give birth to our daughters, but not the other way around. So it was a little bit tough decision also to accept that she would be my donor. So after you finish the stem cell transplantation over 2 days, now the recovery starts, and the team will be watching on the reactions of your body. They will be with you and very close to you all the time. You will be in the hospital for at least from 4 to 6 weeks, or maybe more. It depends on your body reactions. The best scenario is that all the reactions would be mild. When I say reactions, I mean you might experience diarrhea, and everybody experiences this. So no exemption, I'm sorry. So you experience diarrhea and fever, of course body aches, and maybe I experienced it extensively because of the radiotherapy. So when I did the stem cell transplantation, it was already there. I had lots of ulcers inside my mouth and in my throat, so swallowing was a little bit of a challenge for me. So these are the main things. But one of the major side effects or reactions that I experienced, and it was really scary, was the fever. I was 40 degrees fever for around 2 weeks. And I think at that time the stem cell team were really shaking. I remember that it was really tough for me. And I would like here to say something, that when I speak about teams, I'm speaking about doctors, nurses, and the nurses assistants who were always around me, around the clock. Here in Sweden, in Lund specifically, they have like a strategy when they are doing the stem cell transplantation. As long as the patient wants to have his family around, they allow it, because in other parts of the world, some hospitals adopt the same strategy, and some others, they say no, the patient need to be totally isolated. But it really makes a difference to have the family around. Psychologically, it was very, very good for me that I had the chance to have my family around most of the time. So now, after you finish the stem cell transplantation, you start recovery at the hospital. Once your fever comes down and they can see that there is new white blood cells and red blood cells are elevating, you will be starting from zero. Like, you will not have any white or red blood cells, and you will be having new bone marrow producing new blood cells from zero. So starting from zero, when the blood cells comes to certain levels and there is no fever, they will allow you to go home. Going home is a big thing. And I remember that when the doctor said, Passent, we will give you a chance to go in a weekend home, and we will see how this will reflect on you. If the 48 hours went okay at home, maybe we will think to release you from the ward, and then you start your recovery at home. I was really excited to go home, of course, and I wanted to go to my room, my home, my kids. But it was really stressful night. I cried a lot. I was afraid to go home. And I think it was also challenging to enter my room, my bedroom, because I suffered a lot inside this room. So it wasn't easy. And as much as I was really happy to go back, I was really afraid. So if you experience the same and you are afraid, just let the people around you to know that you are afraid to go home, not because you don't want to go, but you have this emotional thing, let them know and speak about it. You will be relieved. The team might give you some confidence that you will be okay, and as long as you will follow their instructions. Of course, most of them are hygiene, so you will be okay, you will be fine, and you will be as you can see me now, you will be okay. So the recovery, when the recovery usually takes for the stem cell transplantation from 1 year to 2 years. It took me more or less 1 year to feel that I am back to normal and back me again. So it is usually like that. Don't stress yourself, because I was really stressed. When I say something don't do, this means that I did. And I don't want you to do the same. So don't stress yourself, and try to take it easy. Listen to your body. If you feel you can't wake up early, don't. If you feel that you can't go out of bed, don't go out of bed. Listen to your body. Stay in bed. If you feel that today I can't go out of the room, don't go out of the room. Starting exercising, it was really challenging for me, and I felt that there was some joint pain, joints, not only one joint. So take it step by step. Short walks would be great, and what I mean short, like I started walking the corridor, and that's it. I know that there's others who can do much more than that. Don't be like tough on yourself. Take it step by step. You are a newborn. You are a newborn. Can you ask a newborn to run the arena? No, of course. You are a newborn, and try to treat your body as a newborn body. So it needs care. Be kind to yourself, and don't push yourself a lot. Don't stretch yourself a lot. So that's it for now. If you would like to know more into details in any of these stages, please just text me. I will share with you all the details. If you feel that you would like me to speak in details or do videos in details on one of these stages, please also text me, and I will do that. So thank you for watching, and I wish you all the best. Thank you.